Shops and salons reopen, so do other personal care services. How are facial care clinics adapting to this new normal? Let's find out from Dr. Aivee Aguilar-Teo, CEO and founder of the Aivee Group. Dr. Teo, great to have you with us on The Final Word.
Hi, Rico. Thanks for having me here.
So in this new normal, doctor, how are you and your patients staying safe and COVID-free in the clinic?
Well, Rico, we have to ensure safety protocols in the clinic. First, for our patients, they have to follow a 4-step safety protocol. First, no mask, no entry. Second, they have to be checked. Their temperatures have to be checked by our thermal scanner, our non-contact thermal scanner. Third is we have to ensure that their hands and their footwear are properly sanitized. And fourth, we have to make sure that they are tested with either rapid test kits or swab testing before they enter the clinic, and that they fill up the medical questionnaire to ensure that we get a good history from them, from who they contacted and their history. At the same time, we have to ensure that our staff and our doctors are properly equipped with the PPEs. We have a customized PPE that we designed with Mark Baumgartner, customized for the Aivee Clinic. We also have the Aivee Shield and the goggles that we use for our staff, and the masks. And also, of course, for our centers, we make sure that they're properly sanitized using the robotic sanitizer. We also make sure that each of the suites are sanitized before and after each patient, and that we also ensure that our clinics are sanitized at night with our UV sanitizer.
Wow, doctor, this is really heightened safety controls that you have implemented in all of your clinics. So how does this basically reduce the number of clients that you can see and have in your clinics per day?
Well, definitely, Rico, we have reduced the number of clinics that we can see a day. Number one is we have reduced our working hours from 10 a.m. to 6 p.m. only. Before, we used to work from 10 a.m. to up to 10 p.m. And also, our workforce has been reduced to 30% only. And at the same time, our acceptance of patients are reduced to 30% as well. So definitely, with all these safety protocols, with proper social distancing, we have to make sure that patients are not waiting inside the common areas, but they're actually inside their suite, so that they don't get in touch or in contact with other patients, or less contact with other patients as well.
You know, doctor, booking an appointment in your clinic prior to COVID-19 was already very difficult. With these new guidelines and protocols, it will even get harder. But share with us, how limited are your procedures in this new normal? What can you do and what can't you do? I mean, under GCQ.
Well, yes. Well, during the entire ECQ, of course, we were closed. Now, during GCQ, we started with consultations only. Either we do online consultations or we do actual consultations in the clinic. But our procedures are limited to pathologic dermatology. For example, eczemas, allergies, acne, burns, infections, and procedures are also limited to these pathologic dermatological treatments only for now.
Thank you so much for sharing your new normal at all of your Aivee clinics. Dr. Aivee Aguilar-Teo from the Aivee Group. And as the beauty industry continues to adapt to the new normal, here's a quote from the Russian writer Leo Tolstoy. Physical beauty always coincides with the concept of health and life energy.